The biggest ever evacuation exercise by air and sea begins tomorrow to bring back around 15,000 Indians stranded abroad, 64 flights on 3 naval ships to ferry them back from 13 countries. In 7 days, only asymptomatic passengers allowed to travel. Leading an all-out war against COVID-19, Prime Minister Narendra Modi chairs task force meeting to discuss progress in India's efforts in vaccine development and drug discovery and diagnosis and testing. Over 30 Indian vaccines are in different stages of vaccine development, with few going on to trial stages. Total active cases of COVID-19 in India stands at 33,514, while 14,182 have been discharged. 1,694 casualties recorded so far. And coronavirus cases across the world stand at over 36 lakh, more than 2,57,000 deaths reported so far. US reports more than 12 lakh people infected with COVID-19 and nearly 71,000 fatalities. Hello and welcome. You're watching DD News and DD India with me, Munmun Bhattacharya, and this is what you can watch later on the bulletin. Arogya Setu IVRS service has started, and you can give a missed call on a toll-free number to track novel coronavirus, even if you don't have a smartphone. We'll tell you how on this very bulletin, so stay tuned for that. Our top focus this afternoon: the biggest ever evacuation exercise by air and sea route will begin tomorrow to bring back around 15,000 Indians stranded abroad. Standard operating procedures for the world's biggest ever evacuation plan have been worked out, and under the Vande Bharat mission, 64 flights between 14 Indian cities and 12 foreign countries will bring back 14,800 people in the first phase. A list of evacuees has been prepared by Indian missions abroad, and the flights would have reasonable charges. And the Indian Navy has launched Operation Samudra Setu, meaning Sea Bridge, as a part of the national effort to repatriate Indian citizens from overseas. Indian naval ships Jalashwa and Magar are presently en route to the port of Malé, Republic of Maldives, to commence evacuation operations from the 8th of May 2020 as part of Phase 1. The government has been closely monitoring the situation with respect to the effect of COVID-19 pandemic on Indian citizens abroad. The Indian Navy has been directed to make suitable preparations for their evacuation by sea. The Indian mission in the Republic of Maldives is preparing a list of Indian nationals to be evacuated. A total of 1,000 persons are planned to be evacuated during the first trip. The ships have been suitably provisioned for the evacuation operation. The evacuated personnel would be provided the basic amenities and medical facilities during the sea passage. Stringent protocols have also been stipulated. The evacuated personnel will be disembarked at Kochi and entrusted to the care of state authorities. This operation is being progressed in close coordination with Ministries of Defence, External Affairs, Home Affairs, Health and various other agencies of the Government of India and state governments.
Immediate 3-day budget session so that take also valuable suggestions.
And as for the latest SOPs issued by the Home Ministry, priority will be given for travel from abroad to compelling cases in distress, including migrant workers who have been laid off. People faced with expiry of short-term visas, those with medical emergency, pregnant women and the elderly will also be given priority. The cost of travel will be borne by travellers. Before boarding, all travellers will give an undertaking that they will go for mandatory institutional quarantine for a minimum period of 14 days on arrival in India. And at the time of boarding the flight, all travellers will undergo thermal screening, and only asymptomatic travellers will be allowed to board. The passengers will have to register on the Arogya Setu mobile app.
All of us are ready to forego all our TADA. We will not take any of the TA, any of the TA.
Prime Minister Narendra Modi on Tuesday chaired a meeting of the task force on corona vaccine development, drug discovery, diagnosis and testing. The Prime Minister took a detailed review of the current status of India's efforts in vaccine development, drug discovery, diagnosis and testing. Indian vaccine companies are well known for their quality, manufacturing capacity and global presence. Over 30 Indian vaccines are in different stages of corona vaccine development, with a few going on to the trial stages. Similarly, in drug development, 3 approaches are being undertaken. First is that the repurposing of existing drugs is taking place. Secondly, the development of new candidate drugs and molecules are being driven by linking high-performance computational approach with laboratory verification. Thirdly, plant extracts and products are being examined for general antiviral properties. In diagnosis and testing, several academic research institutions and startups have developed new tests. The review by the Prime Minister took note of the extraordinary coming together of academia, industry and government combined with speedy but efficient regulatory process. The PM desired that such coordination and speed should be embedded into a standard operating procedure. He emphasized that what is possible in a crisis should be a part of a routine way of scientific functioning. The Prime Minister suggested that a hackathon be held on this subject, linking computer science to synthesis and testing in the laboratory. The successful candidates from the hackathon could be taken up by the startups for further development.
Our heart and win their confidence. No, we should not. We should take them into confidence. We should not force them. We should not keep them.
He added that the innovative and original manner in which Indian scientists from basic to applied sciences have come together with the industry is heartening, and this kind of pride, originality and sense of purpose should dominate our approach going ahead, and it is only then that we can be amongst the best in the world and not followers in science. Well, let's move on now to the other story that we are tracking, and that is on how a GOM meeting took place, and that was the 14th meeting of the high-level group of ministers on COVID-19. It was held on Tuesday in New Delhi, and a detailed presentation on the present status of COVID-19 cases globally and within the country was made to the GOM, chaired by the Union Health Minister Dr. Harshvardhan. The GOM had in-depth deliberation on containment strategy and management aspects of COVID-19, as well as the measures being taken by the centre and various states. GOM was apprised that as of now the death rate is around 3.2%, while recovery rate is more than 25%, which may be taken as a positive effect of the lockdown in the country along with the cluster management and containment strategy. Union Health Minister Dr. Harshvardhan held a review meeting on COVID-19 situation with officials of Gujarat and Maharashtra via video conferencing. Speaking to officials, Dr. Harshvardhan said that the situation in both the states is a matter of concern, as 34 out of 36 districts are affected by COVID-19 in Maharashtra. The Health Minister also assured Gujarat and Maharashtra of all possible help to deal with the situation.
निश्चित रूप से महाराष्ट्र भारत के उन प्रांतों में से एक है जो हम सबके लिए भी थोड़ा सा ज़्यादा चिंता का विषय बना हुआ है, क्योंकि यहाँ पर 36 हमारे ज़िलों में से 34 ज़िले जो हैं वो कोरोना के प्रकोप से प्रभावित हैं। 14,541 केस हो चुके हैं, 583 मृत्यु हो चुकी है। हमें अंततोगत्वा उस स्थिति में पहुंचना है जब हमारे सारे ज़िले एक दिन ग्रीन जोन बनेंगे और वहां पर 21 दिन 28 दिन से कोई भी केस नहीं आया होगा। ये हमारे सबके सम्मिलित और संगठित प्रयास से और मनोयोग से संभव हो पाएगा।
Let's now take a look at the latest updates of COVID-19 cases from across the country. And active cases of COVID-19 across the country have now gone up to 33,514 as per the latest update, and 14,182 people have been cured or discharged till date, while 1,694 people have lost their lives. Maharashtra continues to be the hardest hit state with a total of 15,525 cases. Gujarat has reported 6,245 cases, while 5,104 cases have been reported in Delhi. The Arogya Setu app has started an interactive voice response system service, and one can give a missed call to a toll-free number, and that is 1921, and track the latest about COVID-19. The IVRS call will then check for symptoms, and based on that, the local authorities will be alerted about who has reported them.
देश के हर नागरिक को आरोग्य सेतु से जोड़ने के लिए मोदी सरकार ने एक खास पहल की है। देश के सभी फीचर फोन और लैंडलाइन यूजर्स को कोरोना संक्रमण से बचाने के लिए आरोग्य सेतु IVRS प्लेटफॉर्म की शुरुआत कर दी गई है। आरोग्य सेतु IVRS प्लेटफॉर्म एक टोल फ्री सेवा है। देश भर के लैंडलाइन और फीचर फोन उपयोगकर्ताओं को 1921 अर्थात 1921 पर मिस्ड कॉल करनी होगी। मिस्ड कॉल करते ही ये प्लेटफॉर्म कॉल बैक करके सेल्फ असेसमेंट के तौर पर नागरिकों से सवाल पूछेगा। इन सवालों के जवाबों के आधार पर प्लेटफॉर्म डेटा को प्रोसेस करता है और रियल टाइम में उत्तर देते हुए मिस्ड कॉल करने वाले को SMS भेजकर उसके स्वास्थ्य की जानकारी प्रदान करता है। आरोग्य सेतु IVRS प्लेटफॉर्म की सेवा देश की 11 भाषाओं में उपलब्ध है। मिस्ड कॉल करने वाले को उसी की भाषा में SMS भेजा जाता है। आरोग्य सेतु IVRS प्लेटफॉर्म सेवा से देश के सभी फीचर फोन और लैंडलाइन उपयोगकर्ताओं को कोरोना संक्रमण से सुरक्षित किया जा सकेगा।
The developers of the Arogya Setu mobile app have issued a statement saying that there was no security vulnerability in the contact tracing application. In a statement issued on Twitter, Arogya Setu said that they are continuously testing and upgrading the systems, and no personal information of any user has been proven to be at risk. The team assured everyone that no data or security breach has been identified. The government has mandated public sector and private employees who go to offices to download the app, as also people who are in the containment zone, localized areas where there is a COVID-19 positive case detected. The government has said that the Food Corporation of India has sufficient stocks in its godowns even after meeting the requirements of additional wheat and rice provided free of cost during the lockdown period. FCI currently has 276 lakh tons rice and 353 lakh tons wheat. Hence, a total of 630 lakh tons food grain stock is available. Under the Pradhan Mantri Garib Kalyan Anna Yojana, the centre is providing 5 kilograms of free food grains per month to 80 crore ration card holders. This free of cost wheat and rice will be provided for 3 months. Besides, 1 kilograms of pulses will also be supplied per family. This is over and above the normal quota of 5 kilograms of food grains provided per month per person to about 80 crore people under the food law. The government informed that since the lockdown, about 69.52 lakh tons of food grains have been transported through 2,483 rail rakes. Uttar Pradesh Chief Minister Yogi Adityanath held a COVID-19 review meeting with chairpersons of 11 committees to discuss the current situation. Let's now take you to Kerala, where a small tea shop owner donated for the Chief Minister's Relief Fund. More in this report.
The hazels of daily life won't intimidate Subeda, a 60-year-old tea shop owner living in Kollam district of Kerala. She might be staying in a cloistered house, but her generosity knows no bounds. She stays with her husband, who is recuperating from heart surgery, and her brother is also a heart patient. When Subeda came to know that children are contributing their Vishu money gifts to CM Disaster Relief Fund during this time of pandemic, her desire to donate for the same caught wings. Subeda's small tea shop was not seeing any customers since the lockdown, and her brother and husband are not in a state to earn. But this couldn't stop her. She sold 2 of her goats and contributed to CM Disaster Relief Fund.
Even if 5 people get some relief from my money, won't it be the greatest virtue during this time? I asked my children. My children readily agreed to my idea. I had got rupees 500 from one person as my Ramjan donation, so I clubbed all and handed over to Kollam collector. After giving, I feel boundless joy.
Subeda has better exemplified the need of compassion and selfless service to society during this time of crisis. keeping aside all her personal financial difficulty. With inputs from Neeraj Lal, DD News, Kollam.
Well, the ongoing coronavirus crisis is testing people in different ways. And on the one hand, people are locked inside their homes waiting for the coronavirus vaccine. On the other hand, there are people who are serving at ground zero. One such corona warrior is Afroza Khatun. She is the Sarpanch of Govindpuri village in Nevada district. Afroza is doing sanitization work and carrying out door-to-door awareness drives, giving lessons to locals on hand washing, social distancing and wearing masks. Not only this, Afroza is also providing fruits to the poor and the needy so that they don't face any trouble in terms of hunger in the ongoing holy month of Ramzan due to the lockdown. According to Afroza Khatun, she will do her best and put in all her efforts so that the coronavirus infection does not enter her area. Busting all the rumors regarding a form in circulation on WhatsApp groups with the title Rescue Flights from India for Stranded Indians, the government has affirmed that it has not issued any such form. It has also advised people to abstain from clicking on these links and register only from the embassy's official website. International news now. Since the inception of coronavirus from China's Wuhan city, the virus has spiraled and so far has taken more than 180 countries into its grip. Talking about the infection toll, the total number of confirmed infection among people has risen to 36,65,912 and 2,57,303 persons have succumbed to it. However, countries adopted lockdown to prevent the spread. Meanwhile, many countries extended the lockdown too, and others are gearing back to normalcy with adoption of social distancing measures. The Trump administration has initiated talks on winding down the White House task force on coronavirus and gradually delegating its responsibilities to the relevant federal agencies. U.S. President Donald Trump has confirmed the White House coronavirus task force will be winding down as the country moves into a second phase of dealing with the aftermath of the outbreak. The death toll from the pandemic COVID-19 has surpassed 71,000 in the U.S. with more than 12,03,673 cases of infection. The U.S. death toll is the highest in the world.
We can't keep our country closed for the next 5 years. You know, you could say there might be a recurrence, and there might be, and you know, most doctors or some doctors say that it will happen, and it'll be a flame, and we're going to put the flame out. We've learned a lot. You know, we've learned a lot about the coronavirus. We've learned a lot about this hidden enemy. It's a dangerous enemy. It's a bad enemy.
The UK now has the highest number of coronavirus deaths in Europe. According to the latest government figures, there have been 29,501 deaths recorded due to COVID-19 across the UK. The latest total for Italy, previously the highest in Europe, now stands at 29,315. Both Italy and the UK record the deaths of people who have tested positive for coronavirus. Meanwhile, France reported 25,537 deaths due to coronavirus, but the people in hospital with the infection and those with intensive care units for COVID-19 respiratory disease fell at their steepest rate on record. In the wake of bringing lives and economy back to normal, Vietnamese authorities lifted quarantine in a rural commune in Hanoi after 28 days of putting the area under isolation. The Ha Loi commune, a floral and vegetable farming area some 20 kilometers from Hanoi, recorded Vietnam's 243rd coronavirus patient on the 6th of April and was put in lockdown 2 days later. As soon as barriers were removed at midnight, hundreds of residents in the area came out, chanting, cheering and waving flags to celebrate what they described a victory and liberation over the COVID-19 outbreak. Meanwhile, officials announced that all 2,700 households of the population of 11,500 in the commune are free of the virus. However, residents have been asked to limit their movements until the 11th of May, as well as practice social distancing and wear face masks. Vietnam has registered a total of 271 coronavirus cases and has reported no deaths. Over 30,000 people have been quarantined and over 2,61,000 tests have been carried out so far. Meanwhile, in China, youngsters in the global virus epicenter of Wuhan filed back to class this morning, wearing masks and walking in single file past thermal scanners. Senior school students in 121 institutions were back in front of chalkboards and digital displays for the first time since the city shut down in January. Teenagers sat at individual desks spaced a meter apart, seeing their teachers in flesh after months of distance learning. Only senior students who are preparing for upcoming examinations are back at school. Return dates have not yet been confirmed for junior and middle school students. On a lighter note, nurses at St. Joseph's Hospital in the U.S. danced away their stresses and strains as they celebrated the recovery and release of patient Armando Mendoza, who has spent the last 45 days battling coronavirus there. Mendoza was greeted by nurses and hospital staff that helped him during his ordeal as he left the hospital. A music band on site provided music for the joyous nurses. Meanwhile, people in Thailand are trickling back into Bangkok's famous Erawan shrine amid relaxing coronavirus restrictions, with the devout once again wishing for good health and fortunes. The shrine was closed for more than a month, reopening with dancers once again performing in worshipping ceremonies and folk outfits with face shields as a precaution. In other news, 6 people have been killed on board as a plane carrying aid supplies for use in the fight against coronavirus crashed in Somalia. Although the cause of the crash has not yet been ascertained, Somalia's Transport Minister Mohammed Salat said that the deceased include a pilot, a co-pilot, flight engineer and a trainee pilot, as well as 2 people working for the airline who were on board. According to media reports, the plan was of an African Express Airways plane. So that was the plane. A massive fire has been reported in one of the residential towers in Sharjah. According to reports, the building is inhabited mostly by Indians. The quick response by Sharjah civil defense teams averted a major disaster as per authorities. And the name of the building is Apco Tower, which is one of the tallest buildings in the area with 40 floors. The reason for the fire is not known yet. According to an eyewitness, the fire is now under control. However, the building is still apparently simmering from inside. No casualties have been reported so far. Meanwhile, residents of the nearby buildings have also been evacuated. A Chinese developer of artificial intelligence and augmented reality technology for manufacturing and gaming applications has found a new focus in the midst of a global pandemic. Hangzhou-based startup has developed a pair of augmented reality glasses, enabling the user to detect temperature from a distance. The new coronavirus, first detected in Wuhan, the capital city of China's central Hubei province, has so far killed more than 4,600 people and infected nearly 83,000 in China. That's all that we have for you in this news bulletin. But before we wrap up, we leave you with this video in which Bollywood celebrities and others like Virat Kohli, Ayushmann Khurrana, of course, being in Bollywood, Kriti Sanon also being in Bollywood, and Sara Ali Khan, they all pledged support in the fight against fake forwards on social media. And they celebrated urging people to stop forwarding videos which do not have verified information. Let's take a look.
एक लापरवाह टच से लाखों तक पहुंच जाता है।
और एक बार ये महामारी फैल गई ना बॉस, उसे कोई नहीं रोक सकता।
जी हाँ, हम बात कर रहे हैं उन फॉरवर्ड्स और वीडियोस की जो नफरत और अफवाहें फैलाते हैं। ये भी हमारे समाज का एक वायरस है।
उत्तर दिशा में सोने से डायबिटीज ठीक हो जाता है।
देखिए लोग कैसे देश को बर्बाद कर रहे हैं। ये वीडियो 10 लोगों को फॉरवर्ड कीजिए, गारंटी लड़का। ऐसा करने से ना कैंसर ठीक हो जाता है, वैसा करने से ना भूकंप आ जाता है। ऐसे वीडियोस और मैसेजेस फॉरवर्ड भी होने चाहिए और बनने भी नहीं चाहिए।
जब भी आपको कोई ऐसा वीडियो मिले, कोई ऐसा मैसेज दिखे जो आपको सही ना लगे,
अगर उससे किसी का नुकसान हो सकता है,
अगर सूचना सीधा गवर्नमेंट से नहीं है,
तो उसे मत कर फॉरवर्ड।
और देखोगे कि ऐसा करने से तुम सेफ रहोगे, लोग सेफ रहेंगे और देश सेफ रहेगा। तो
मत कर, मत